Hello, Yellow Medicine East community, students, staff, and parents. I'm here for your weekly learning model update along with Crystal. So let me share my screen and let's take a look at it. So I didn't do one last week. We did not have a formal incident command team meeting last week. So the last two columns are what has happened in the 14-day case rate. Some schools and some areas are not even considering what that 14-day case rate is, but it kind of gives you the temperature, a flavor of what's going on in our communities, at least regionally. Again, just like last time, it puts us in distance learning for the recommended model. This also gives you an idea. We have statewide spread. Only one county is less than 50 in all of the counties in Minnesota at this point. Yesterday's data, you can see those on the far right-hand column there. Those were the new cases. Chippewa and Renville County are quite a bit higher than us. So, of course, Chippewa has a higher population than us. And Renville County, that is concerning. They've had an outbreak there for a while. And I don't know all of the details of it, but I would suspect it's in some long-term care facilities. You can see those numbers have grown quite a bit in the past week in the total cases. So we are in the midst of it, folks. These are our active case status for each of the counties. Yellow Medicine County actually dropped by 2 compared to what it was last week. This is compared to last week. So I did update these slides last week and shared them with the incident command team, some of the data. Chippewa County continues to grow. Lacaparo County has dropped and Renville County continued to grow. So we suspect we'll see that in their 14-day case rate data. COVID-related absences, total staff, we grew by 36 in the past 2 weeks. So I made a mistake when I gave this to our incident command team last week. So that's why that's in red there. So that's 2 weeks worth of data, but the rest of the data is week-old data. So staff positive district-wide, this is as of yesterday, grew by 5. BRE grew by 4, again, as of yesterday. And the middle school, high school grew by 20 as of yesterday. I can tell you we've already done some work today and those numbers have grown already today and will continue to grow throughout the day today. So total positive for students district-wide grew by 9 in the past week. That's just in 1 week there. So again, that has grown today also. Current active student data as of yesterday, roughly 2.8% of our middle school, high school enrollment is active for COVID, and BRE is a lower number, 0.4% of our 277 students there. This gives you the count for our zip code data. You see that, you know, generally speaking, Granite Falls proper had not seen the growth. Guess what? We are on the top of the list now, except for Montevideo, with the most number of cases. Canby grew by 9, Clarkfield by 11, Henley Falls by 2, Echo by 11, Porter by 6, Woodlake by 7. Now, some of these smaller communities, such as Clarkfield, Henley Falls, Echo, Porter, and Woodlake, those are significant increases for their general population. You look at their city and zip code population is a lot lower than Granite Falls. So we're seeing a pretty steady indicator that they are pretty high. And Montevideo, obviously, you saw from other information that it has grown quite a bit. Predicting future trends on the top there, that's that number I showed in the first 14-day chart. If we look at what was 1 week out, that's what we anticipate they will be right now. Some of that can be scrubbed out. So both Yellow Medicine County and Chippewa are showing significant growth. And then what we expected, the real-time data is still pretty high, 153.08 for Yellow Medicine County and 233.83 for Chippewa County, pretty high numbers there in our community. So we met yesterday with our regional support team. Some of the points the Department of Health brought up is they want us to consider pretty carefully the active cases in our county. So that's why I provided that information for you folks, and the incident command team was able to look at that also. Quarantine numbers within the school, that was a slide here too. The 14-day case count. I told you a lot of areas are no longer really looking at that. They still want us to continue to look at it. It is not the only indicator or the only set of data that we'll look at, but it does tell us what's happening in our community. The active and quarantine cases that we expect for Monday, sometimes that's hard to figure out. It takes a lot of going through spreadsheets to figure that out, but I suspect right now, if my math serves me right, yesterday, I think I had 10 staff members that would be impacted. And I suspect, if my math serves me right, that we're going to be 12 on Monday. So it grew a little bit, probably 2 today, but can't verify all that yet. Haven't done all the work associated with that yet at this point. Local data such as beds in hospitals. So I did talk to a local healthcare provider. The hospital is full with beds, and as soon as one leaves, another one comes in. It may not just be Granite Falls City. It may be from some of the surrounding communities that have overflow. Part of the reason beds are full is because there's enough patients for them. Part of the reason is because staff in those facilities, our hospital, etc., they are out sick. And even if they had more staff, those beds would fill anyway because we're just using up beds that quickly. Statewide trend data they ask us to take a look at. We know that that's high. So they recommended staying in distance learning until January. That is what that regional support team has recommended. Other points to note. So the past 2 weeks have been especially challenging. So I haven't done this video for 2 weeks, but I wanted to kind of give you a heads up on that. We did have cases related to volleyball and football. I know there's out there this idea that there's no cases from our activity. Of course, it represents the community as a whole. There's going to be cases, and that did come up. There are cases, even though we're in distance learning, that are out there outside of the school. We know that, and we aren't necessarily, the third point there, we aren't necessarily hearing that they're positive. So we need to hear about that so we can make our plans accordingly. We discovered some of our cases after we were doing our contact tracing. So we would prefer that you let us know ahead of time. One thing to note too, and all the research says this, and Countryside Public Health and the Minnesota Department of Health has pointed out to us too, adults tend to have more severe symptoms, but students are likely to have positivity at the same rate as those adults. So, and of course, students can spread that virus just like adults. So we can't say that that's only happening in our adults or even in our staff members if we just consider the school district or the school as an isolated unit. Families and staff, we understand, may prefer longer decisions for planning purposes. We understand that, and we try and reach a balance with that. That's why our last decision was based upon a two-week decision. Next week, though, we decided just for a 1 week's decision, and we are going to have a special board meeting to take a look at some other options that we may have and how that might be impacted, and if the board can give us some feedback on their thoughts on those other scenarios that we'll take a look at with a special board meeting at 6 o'clock on Wednesday night. A couple other things to get you up to date. The vaccine, don't expect it anytime soon, especially for students. It may come to our staff, likely would come to our staff before our students. We hope that people will take it, but the priority in the first round will be medical professionals. They will be the priority, and some of those other high-risk areas such as long-term care facilities. So students are a little bit down the line, so the time, it's not done. We haven't reached where that vaccine will help us yet. We hope to hear news shortly. Quarantine timeline, I know the CDC put out the 10 and 14 day, some 7, 10 and 14 day guidelines. We won't act on that until the Department of Health gives us that. That's the rules we have to live by. When they tell us we can change, we will. Staffing for next week, I talked that probably 10, maybe as high as 12, and a lot happens over the weekend. We'll be out on Monday already. And that really is kind of determining the number of, or the decisions that we're making at this point. Want to remind everyone that there are many people out there that we're hearing, they aren't testing their children. They aren't testing because they don't want to be out of work. Well, remember, if you pay your dues now by getting tested and become positive, that's basically what we call a golden ticket for 90 days where you would not have to be quarantined anymore. I know it's a challenge in the beginning, but that is, sorry, that's Nurse Cassie. That is something that I hope you will get on board with, getting people tested. The other thing with testing too is, say you as a parent are positive for 14 days and you have a kindergartner that cannot isolate. You're positive, you do your quarantine for 14 days, and then your child would have to also quarantine for another, or you do your 10-day quarantine, then your child, your kindergartner, would have to do a 14-day quarantine. We call that a 24-day quarantine. That's motivation to get your child tested so we know what's going on. The other thing that was big news yesterday was the Minnesota State High School League came out with 3 different scheduling proposals to start activities on the 21st, the 4th, and the 18th of January. The ICT recommended that we don't just automatically do what the Minnesota State High School League suggests. We'll take a look at that at our Wednesday board meeting and kind of try and come up with a plan for that. But understand the Minnesota State High School League is still, they are under the control of the governor also. So if the governor extends on the 18th, if he extends the lockdown for longer, that will affect Minnesota State High School League unless he deliberately carves them out of that scenario. Okay, so do you have questions for me? You think I covered it well enough?
No, I think you did a great job covering it. It's just the fact of reiterating, we don't want to try and pull symptoms out of you. And Rich did you did a great job of, asking for that. Reminder that if you are calling your child out, to please leave those symptoms either in an email or on the voicemail, because that is a great big help. Other than that, I hope that we'll get to see the kids back here as soon as possible. So
yeah, remember, mask up, social distance, practice those guidelines that the CDC and the Department of Health put out for you folks. We need these students in our school, but we have to do it safely, because if I don't have staff in front of the students, we can't have school. All right. Yep. Stay safe, everyone. Thank you.